There you go.
Everyone, my name is Dana, and the project that I've been working on this summer is called Investigating the Unintended Impacts of COVID-19 Isolation on Long-Term Care, Residents' Cognition and Motor Function. I would like to thank my mentor, Dr. Deb Sangbai, as well as Heather Jacobson and the rest of our team members for helping me through this process. So for some background, skilled nursing facilities, referred to as SNFs, care for about 1.5 million residents in the United States, and the elderly skewed age distribution of these residents and the pre-existing conditions that many of them have make them a high-risk COVID-19 population. So this is a population that's seen high case fatality rates, and below is some recent CMS data showing cases and deaths in residents in skilled nursing facilities. So as a result of this, isolation procedures and no visitor policies have been adapted, also as a result of the congregate living spaces, which are very conducive to rapid transmission of disease. And now emerging concerns are about the cognitive and physical decline of residents as a result of this isolation, which has kind of turned into the main focus of our work. So the goals of this project have been to understand the impact of COVID-19 isolation on SNF residents as well as staff, to focus on changes in residents' cognitive and motor functioning to improve care models and staff education, and to qualitatively analyze and probably eventually quantitatively analyze data collected within SNFs. So we've been planning to utilize the Duke Hope SNF Collaborative, which is essentially made up of many different SNFs across many counties nearby, and is a formal collaborative that kind of functions underneath the Duke Health System. So this project is split into two phases, essentially in the short term at least. So those are, one, conducting qualitative interviews with both staff and residents, or if a resident is not cognitively able, then a proxy within SNFs in the collaborative, and then refocusing our NIA grant, which is intended to supplement Janet Becker's existing Duke-Roybal grant. So we want that grant to focus on some of the key themes that we find in this qualitative analysis. So the population is divided, as I said, into providers and residents. And the providers include nurses, nurse practitioners, CNAs, speech language pathologists, or just any other staff that work directly with these residents. And then, as I said, if a resident is not cognitively able, then a proxy will be used in place. So each population has a different perspective on the impacts of this isolation, but we're looking to get a better understanding of changes in things such as mobility, communication, mood, socialization, and self-sufficiency among residents, as well as how technology has played into this, such as telehealth, and then also what mental health resources have been provided for staff, because this has been a very difficult time for them as well, working this high-risk, high-stress job. So our immediate next steps and deliverables are to complete the interviews pending IRB approval. We're still in the process of that. It's been a pretty long process, as I'm sure many of you know. And then after we get that data, we plan to transcribe it and qualitatively analyze it by pulling out themes. And then refining our NIA grant specific aims, again, to supplement the Duke-Margolis Center. And the main focuses on this will be addressing this cognitive and motor decline. And something we've also been interested in bringing into it is using some minimum data from these SNFs, which basically are federally mandated, like, I guess, updates on patients, including both behavioral and physical data. So some main takeaways from what I've learned this summer are that the impacts of COVID-mandated isolation on both residents and caregivers must be addressed, and these quality improvements that emerge from it should be applied to other future epidemics and outbreaks, not just COVID-19, because I think there's a lot to learn from this time. And research in SNFs in general is just gaining a lot of attention and relevance, so I'm excited to continue this work beyond the internship program as a Margolis scholar into the fall and beyond.
Great.
So that's all I have.
So we have time for one question from, if anyone has one from folks.
I have a question, but if someone else has one, I'm happy for someone else to ask.
No, you can jump in.
Okay. Hey, it's Charlene. Great presentation. I was wondering if you guys have had enough of a sample or started hearing anything about disparities in different types of nursing home or different types of SNFs, excuse me, and different cultures, for example, and potentially also interesting strategies that some groups might have come up with for mitigating some of the negative impacts of the isolation.
So we're not there yet because we're still pending IRB approval, but that's definitely something that we've been thinking and about and discussing, especially the fact that there are a very diverse demographic set of both residents and providers in these facilities. So we want to account for that in our sample and make sure that we're getting a representative sample in terms of race, socioeconomic status, et cetera. And I would like to incorporate that more into this work going forward.